Welcome to the sleep program at the Monash Institute of Cognitive and Clinical Neurosciences. Our program brings together outstanding researchers and state-of-the-art research facilities linked to clinical services that will make a significant impact on the sleep health of the nation. More than 16% of the Australian workforce is engaged in some form of shift work. We know that shift work has a major disruptive effect on the biological clock and the sleep-wake system. Shift work is linked to a range of adverse health consequences, including depression, cardiovascular disease and obesity, and a marked increase in motor vehicle crash risk. Here at the Monash Institute of Cognitive and Clinical Neurosciences, we are studying the mechanisms underlying the biological clock to better understand the effects of shift work on health and well-being. We're also developing strategies to improve health, safety and productivity, including scheduling systems and dynamic lighting systems, as well as personalised sleep management systems.
The sleep group in the Monash Institute of Cognitive and Clinical Neuroscience has a very robust insomnia research program where we're interested in three main questions. First, we're investigating the brain mechanisms that underlie the development of insomnia in the first place, because insomnia is actually a very complicated disorder from a neurophysiological perspective. Second, we're very interested in understanding the daytime consequences of insomnia, particularly the cognitive and mental health consequences. And third, we are developing and investigating new interventions for insomnia so that we can bring treatment services to populations that don't respond well to the current gold standard treatments. And these would include populations such as new mothers, couples, and patients with post-traumatic stress disorder.
We've developed a multidisciplinary insomnia and circadian clinical service which involves our sleep physicians, sleep psychologists and clinical researchers. And this service is designed to deliver, first of all, an important community service for our regional catchment, as well as provide an important recruiting source and a support mechanism for our clinical research trials.
We also research sleep disturbance in the real world and try to make sense of how sleep disturbance could contribute to our emotional experiences as well as mental health, whether that's in parents with unsettled infants or adolescents who struggle to get up in the morning. We're also interested in how sleep could play a role in the development and also the maintenance of mental health conditions, for example, major depression and post-traumatic stress disorders, and how improving sleep could improve the outcomes of these mental health conditions.
Every one of us has a clock in our brains that helps us keep time with the 24-hour world. This clock helps us eat, sleep, be alert at the right time of day. We synchronize this clock to our world through our response to light, but not everyone responds to light in the same way. Some people respond hyperactively, such that they're perpetually misaligned with the day-night cycle. This can result in sleep disorders like delayed sleep-wake phase disorder, where people can't have a normal bedtime. And it also might make some people more vulnerable to depression. And we're studying ways to treat that through understanding an individual's responsiveness to light and how to change it.
Obstructive sleep apnea is a very common sleep disorder associated with serious cardiovascular and neurocognitive consequences. Unfortunately, while the leading treatment we have for the disorder is highly effective, it's poorly tolerated by many. We do have several other options for patients. However, predicting which patients are likely to respond to a particular intervention is a big clinical challenge at the moment. Interestingly, we now know that obstructive sleep apnea is caused by a multitude of factors. So here at the Monash Institute of Cognitive and Clinical Neurosciences, we're developing simple clinical predictive tools to measure this physiology that can be used by a physician in order to predict which currently available therapies should be given to a particular patient. We're also using this information to develop novel and new treatments so that we can better treat the far majority of patients with obstructive sleep apnea.
We use both laboratory-based and also field-based approaches to understand how challenges to the sleep-wake system impact human performance. More specifically, different measures of alertness, attention, and cognition. We understand that around 20% of motor vehicle crashes are caused by drivers falling asleep at the wheel. Currently, we have no tools or systems which accurately predict when this is going to occur. We employ a number of field-based or laboratory-based approaches to understand how challenges to the sleep-wake system impact on human performance, more specifically on our measures of alertness and attention.
The Monash University Health Sleep Clinic provides evidence-based and cutting-edge treatments for insomnia and circadian disorders to the broader community, while also serving as a platform to foster research excellence, professional training and education. Find out more today at monash.edu.au/neuro-institute.